So yes, we're moving right along. So Lab Monday, we'll work on our evaluation. If there's any questions related to how we divided that up and what projects you're working on. Final exam scheduled for that Wednesday. I know some of them mentioned there's a problem with that. We'll make adjustments. We'll move wherever we need to. So the rest of the semester, lectures are going to be taken up with mastitis. Labs are going to be associated with the farm evaluation. Our exam will be in and around the 19th as per schedule with the college. Any questions or concerns? Okay, so mastitis. What do we know about mastitis? Anything? Extremely common. What else?
Not very good for milk quality.
Not very good for milk quality. Can be easily spread, depending on the type.
Environmental or non-environmental.
Okay, that's one way to split them up. So what do we know about mastitis? Technically, a definition is the inflammation or irritation of the mammary gland. So mast having to do with the mammary gland. Itis is that swelling or irritation there. So it's very non-specific as to what it might actually be. And it really comes down to when you're managing on a farm, can you identify what's causing the problem? And once we identify what's causing the problem, I hope to have that opportunity before the end of the semester. At least one way to do that. So mastitis, what could cause swelling and irritation? Certainly physical trauma might cause a problem. We fired somebody a couple years ago for kicking cows. So that was probably an issue. Could be chemical issues, burns, some way, shape, or form might lead to that swelling or irritation. But when we're getting on farm, we treat our cows well, we keep them away from chemicals. So almost always bacteria of one type or another are causing the issues. So the ultimate cause is bacteria. The question is, what promotes their entrance into the mammary gland? So you've got infectious organisms. The more you have, the more likely you are to get an infection. There's a certain heritability associated with that. We look at somatic cell counts and the heritability therein, so you can select for animals that may have a tighter teat end, higher udder, less sloppy, cows that just keep themselves cleaner. The characteristics of the cow will influence whether she gets mastitis. The milking machine can play a part as well. So we'll talk about that in a second. Milking procedure. How do we keep the bacteria away from the teat end? How do we keep the bacteria out of the milk? What we do, how we do it, can influence the risk of mastitis. The environment. So clean, dry are our code words again. We want to use that over and over again for a lot of different places. Clean and dry helps reduce the bacterial load. helps prevent bacteria from getting in there. So the effects of the milking machine on mastitis. We've alluded to these already, but let's make sure we get them down. So the machine can hold bacteria, and certainly with staph and other contagious bacteria may transfer bacteria from one animal to another, leave it on the skin. Eventually those bacteria might work their way down to the teat end and into the mammary gland. The pressure changes that are going to cause transfer or even impacts, and this is the milking machine. If we don't have that consistent pressure at the teat end, that vacuum, consistent level of vacuum, or we have liner slips that let air in and fluctuate that vacuum. So we talked about impacts when we're talking about machines. This is an illustration of that. An older claw design on our milking machine will allow air coming in from one corner of the udder to diagonally cross, accelerate, and put droplets at the teat end of that diagonal quarter. If those droplets are infected, moving fast enough and hit their target at that open teat end, they may end up in the other udder or other gland. So if they get a foothold there, you're going to have an infection on the opposite or on the diagonal. So we've got those pressure changes that might force bacteria into the udder. We may have inadequate liner function. Things are not properly collapsing and opening. We don't have an adequate or proper rest phase or milk phase. That inadequate liner function might cause teat end damage. So over milking, not getting a good massage phase is going to lead to that hyperkeratosis at the end, that callus that causes all kinds of trouble. If we don't get enough milk out, maybe there's an opportunity for the animal to leak. That animal leaks on a bed. If they're sharing that with another animal, maybe another animal comes in and picks up whatever infection that animal had. We also, more milk left in the udder. There's an opportunity for infection right after milking. So those are related, or things we might blame on the machine in some way, shape, or form. We talked about how to get rid of those. Those, if we do our maintenance, if we do our cleaning, that should be minimized. So clinical mastitis, when we can actually see some sort of symptom related to mastitis. So subclinical, the cow is infected, but there's no obvious signs or symptoms associated with that infection. So clinical, we can see symptoms. So you've got that sheet there that talks about the different scores. So for clinical mastitis, we're going to score the animal a 1 if something has changed about the milk. So that's our first clinical symptom. Abnormal milk, flakes, clots, different colors, any of that might be associated with our 1, where the milk is only affected. We move up to our score 2. We have the milk and the gland involved now. So clinical signs, abnormal milk, we're adding to that, the gland has reacted in some way. We're seeing swelling pain, firmness, anything that's going to indicate that that hot quarter is infected. So milk to the gland. As we move up one more, we get to severe clinical mastitis. Now we're involving the entire body of the cow. So abnormal milk, the gland is involved, swelling and pain, and then we may see symptoms throughout the entire body, fever, dehydration, possibly shock with our toxic mastitises. So the whole body is trying to fight off that infection. So how we react to it, how we treat it is influenced by where we are. So what is the cow? What treatments, what signs of my diagnosis do I deal with first? So how might we remember this sequence as to which involves where? 1, 2, and 3. One thing's involved. Three things are involved. How do you remember which ones are which? I tend to think of, we start with the milk, we go out to the gland, we go out to the cow. So working inside to out is the way I tend to remember it, or try to recall it when I need to. So this is your handout. So this goes through all 3 there. We're doing a subdivision on our 3. So 1, abnormal milk. 2, abnormal milk. Swelling in the quarter, pain, sensitive to the touch. No fever, no bodily symptoms. 3, we're picking up that fever. We're above 102 is the American Association of Bovine Practitioners calling that out. 3, we get into whole cow, very severely sick, and we need to start to treat some of those symptoms for that animal to recover. So general treatment plan, all things being equal, are 1, we're going to think about oxytocin and trying to get as much milk out of the cow, out of the mammary gland as we can. Not recommending antibiotics in the short run, unless that clots, that abnormal milk continues for a few days. So moderate, you're starting to get out as much milk as you can with oxytocin, extra milk out, perhaps milking that cow more frequently. Antibiotic IMM, is that, everybody knows what that abbreviation is? Intramammary infusion. So putting antibiotics into the gland and or throughout the entire body, depending on what the label says and what is indicated with the thing we're dealing with. As we get to our 3s, we're adding pain relief, anti-inflammatory for the entire body, perhaps giving her IV fluids, saline. That's not a lot of fun to keep that IV in for a long time, to feed a large amount of saline in. So one way to get around that is the hypertonic IV, that you put the small bottle in the IV and then you have that, you force that animal to drink. Usually with the toxic mastitises, it's pretty important that we get that liquid into the body so it can flush out all the bad stuff that is floating around the body associated with that mastitis. Pretty straightforward. Any questions on any of that? So mastitis causing bacteria. we'll put them into two categories in this class. There are some other people that go a little bit more, but I think this gets the job done for this class. We have environmental and contagious. So from the sounds of environmental, what are we thinking about? So it's in the environment, it's there. We're going to pick those up. Contagious has to do with the milk of one cow getting to the milk of another cow. So this is milk to milk transmission. So we'll get into these names again. Some streptococci, enterococci, coliforms such as E. coli and Klebsiella are very easily in this category. Contagious, and we'll go through all these one by one. Things that seem to move from milk to milk. Strep ag is kind of the historical one. We don't see it as much as we used to. Very easily controlled, very easily eliminated from a herd. So if you're doing any of the things that are preventative or any of the milking procedures that are right, strep ag is not usually a problem, but every once in a while you'll find a herd that hits that problem. Staph aureus, fairly common. Most farmers refer to it as staph. This is a very persistent infection. That infection will last or can last pretty much the whole life of the animal. It's very hard once it gets a foothold in the udder to get rid of it. The same with mycoplasma. The downside is standard control antibiotics have no effect on the mycoplasma. So, whereas you can use penicillin on Staph aureus and strep ag. So the environment, as we mentioned, is things caught from the environment. So it comes down to a question of numbers. How much bacteria is at the teat end? How much challenge do we have on that cow? Are we keeping our udders clean? Are we keeping our beds clean? Are we making sure that the cows do not lay down until that teat end is closed? The more of those things we can do, the more we can make things clean and dry, the less environmental we'll have. Although if you're doing a lot of good prevention for mastitis, generally the only ones you get are environmental. A lot of people talk about testing and stuff, and it's like, well, it always comes back environmental. So, but occasionally you get that staph one. Contagious is caught from another cow. We're talking about milk to milk transmission. So that can come from milking machines, that can come from your hands, that possibly can come from the foot of one cow brushing up against another one. You've got beds where cows leak, then they lay down. Another one lays down, picks up that milk on their teat ends. You can, by sharing a towel as during prep, you can get that milk to milk transmission. So there are some places that will use a towel for two cows, trying to economize and realizing that probably the whole towel is not used on one cow. The question is, does that milk soak through? If it does soak through, you're inoculating the next cow. So that's why we go to individual towels, is a standard recommendation. So management, as we mentioned last fall, has to be the barrier between bacteria and the teat end. So we want to keep bacteria away from the teat end. We want to keep them out of the mammary gland. All the things that we do on a farm will help minimize that contact, minimize that opportunity for the bacteria. And we talked about the balance between challenge and defense, not necessarily in this class, but other ones. The more challenge we have from the bacteria numbers, more bacteria getting to the teat end, the more likely we are to get mastitis. Our defense, our preventative measures that we do as managers, the cow's immune system, their first level of defense, the barriers, the skin, the mucous membranes, the things that will keep bacteria out. Second line of defense is the non-specific immune system. That's going to show up a lot in mastitis. And the third line of defense, we have specific directed white blood cells fighting against specific bacteria. That's where our vaccines come in, our J5 and things like that. We're focusing on a specific bacteria. So identifying bacteria. If you look at the science of microbiology, has anybody had a microbiology class? So staining, there's lots of different ones out there. This is how, in the early days, they'd separate bacteria. Well, if you put this stain in it, it's this color. If you put that stain in it, it's that color. Moving through, since then, we've changed to more direct measures, things that we can look for. But gram staining is the most basic. It pretty much divides all the microbes into two categories. So you take the bacteria, put them on a slide, stick them under a microscope, and then you add the gram stain and see whether the bacteria pick up that stain, turn a color. The bacteria that hold the stain are gram positive. So they are positive to the gram stain. The bacteria that do not pick up the stain, do not hold that stain, are called gram negative. So the gram stain, we apply it. Those that pick it up are gram positive. Those that don't are gram negative. So how does that happen? Our gram stain is influenced by how many layers are on our bacteria. So if we look at our gram positive, we've got the standard bilipid membrane, that light green here. We've got a space in between that layer and then another outer layer, a shell that's made of protein and carbohydrates that helps protect, helps shape that bacteria. If we look at our gram negative, we still have the plasma membrane, we still have the space, we still have the protein and carbohydrate, the peptoglycan layer, and then we have an outer layer that's lipid, carbohydrate, and protein. So with the gram negative, we have an extra layer of protection with that bacteria. That extra layer is going to influence how we manage our mastitis. Gram positive, gram negative. So that extra outer layer is preventing that stain from getting in. So when we're working with our bacteria, if we can identify them we can set out on different courses of treatment. Does anybody work with a farm that identifies bacteria before they start biological treatment or antibiotic treatment? Most people don't. But we'll show you some different ways that you could incorporate that. So gram positive, we're going to treat one way. Gram negative, we're going to treat another way. So there are very strong divisions as to what we do with the gram positive versus the gram negative. And the first thing is the reaction between the gram positive and negative to antibiotics. So our gram positives, we're going to have our streptococci species, our staphylococci species are going to respond to standard intramammary antibiotic treatment. This is usually penicillin based. So using penicillins without that extra outer layer, those gram positives are susceptible to that treatment. Penicillin goes in, disrupts the membrane of the gram positives. The bacteria become in equilibrium with the environment and they die. The gram negatives, and we'll say one subset of that is the coliform mastitis, E. coli, Klebsiella. You might put mycoplasma in that coliform group, but they're very different, so maybe it's not the best idea. But none of them will respond to intramammary IMM antibiotic treatment, especially the penicillins. They don't do well. So in some cases, if you have a gram negative with your cow, that's the infection in the udder. You're better off probably squirting that bacteria, that treatment on the ground, if it's a penicillin-based one. At least that way you won't contaminate your milk supply. So the challenge as managers is doing the right thing, picking the right treatment, because sometimes doing nothing might be actually better than doing something. And that's a hard thing for you to do. We as humans, we want to do something. We want to do something to address the issues in some way, shape, or form. Does anybody need that any longer? So gram negative, let's talk about them for a little bit. So as we've noted in that diagram, they have that extra outer membrane. That makes them a little tougher to deal with. That prevents the gram stain from getting in. It prevents penicillins from being deadly to those bacteria. So that extra outer membrane acts as a shield. Penicillin-based antibiotics do not work, do not kill these bacteria, as penicillin disrupts the plasma membrane, disrupts the peptoglycan. So the bacteria starts leaking and cannot come back from that as it achieves equilibrium with the environment. So we have with the penicillin, the gram positive, it's going to break this membrane, break this one. With the extra outer one, the gram negatives, even if those leak, they can still get through it until repairs are made, until the antibiotic fades away. So that extra layer provides some protection. So gram-negative, the classic members of these are Escherichia coli, E. coli, Klebsiella. These are the ones that tend to lead to that toxic mastitis, things that are very, very disruptive to the cow for 24 hours, and then they tend to clear up on their own. So cows can, in most circumstances, but not all, clear that infection on their own. We keep them happy, healthy, comfortable, well-fed, hydrated. They should get through it. So we can group that coliform mastitis, those associated with the environment. So E. coli, Klebsiella, coliform mastitises, they are environmental in origin. So they don't transmit. If one cow has an environmental coliform infection, it does not translate well or transmit easily to the next cow. Not necessarily contagious. And we think about poor bedding, too much manure in the environment, leading to these infections, too much manure at the teat end. The coliform mastitis, as I've mentioned, it tends to be acute, sudden onset, reasonably quick resolution, as opposed to Staph aureus, which will be a chronic mastitis. They're going to get that and they're going to keep it for a long time. So comes on fast, gives the cow a good knock, and often clears up fairly well if we can support that cow, help her through the symptoms, clears up, gets through. So we're thinking about clinical signs for coliform, a subset of our gram-negative. We're seeing that clinical third level of mastitis. So you're going to have a swollen quarter, you're going to have abnormal milk, clots, watery, fever, dehydration. And possibly, if it gets severe enough, that animal will go into shock, not necessarily responding well to responding to the environment around them. So these are our mastitis level 3. So with the gram-negative, with the coliforms, the destruction of these bacteria by the white blood cells releases endotoxins. Those endotoxins are going to make the cow feel really, really bad. They're going to spike that fever. They're going to tell her, I don't feel like eating, I don't feel like drinking, I'm blah. So those whole body issues are going to come from the endotoxins that are inside and released or produced by those gram-negative, those coliform bacteria. So effect on the cow, the endotoxins are going to be responsible for a lot of the symptoms or a lot of reactions we see in the cow. They're going to cause that fever. They're going to affect the brain. They're going to shut off the appetite of the cow. They're going to shut off her desire to drink. So we might have to force that issue with a hypertonic IV. The quarters react strongly to that endotoxin, and because we're bringing in plasma as that swelling occurs, the milk is going to move toward something that looks more like plasma than it does milk. Depending on what's in there and what's reacting to it, it might have some colors as well. So for coliform mastitis, usually associated with manure, we're going to try to keep the bacteria in the environment, these coliform bacteria, gram-negative bacteria, away from the teat end. So clean, dry bedding, pre-dipping and post-dipping seem to be very effective in preventing, controlling these forms of mastitis. Not perfect, but usually there's a mess up somewhere along the way where we allow that bacteria, those coliform bacteria, to get to the teat end. So we might consider lime in the short run. So what does lime do for us on our beds?
So that makes the environment less suitable for bacteria.
So by making it drier, and it'll affect the osmolality surrounding that bacteria. If it does get wet, that's a hyperosmotic environment that's going to dry out those bacteria pretty quick. So we might do those things in the short run if we've got an outbreak, try to get caught up, or in the mud season. Well, we're looking long-term stall management, keeping things dry, keeping things clean. Making sure that we prevent that manure from piling up, the bacteria living and growing on that surface and getting to that teat end. So before and after milking, if we can minimize with pre and post dipping, kill those bacteria, that is also helpful. So treatment. If you're going to go with a gram-negative, you have to have a treatment, an antibiotic that's specifically designed for your gram-negatives. And probably about half the treatments out there do not claim to affect gram-negative, the coliform bacteria. So there are common treatments. We'll show you those probably next week. Those treatments, they'll say on the package, not for gram-negatives. But yet we use it. If we don't identify it, we use it. You're better off squirting it on the ground than you are putting it in the cow. So amoxicillin is a classic for that broad spectrum. Treating the symptoms, getting the IV fluids in the cow to help her flush the endotoxins out of her body. Hypertonic saline, forcing her to drink, putting that wave of water through the body. You can do a very large sterile saline drip if things get really bad, but that's something you got to check on quite frequently because cows tend not to hold their IVs in one place. We can work with the swelling, trying to keep things down. So anti-prostaglandins that are going to lead to that local swelling. Aspirin helps out here, breaking up the reactions of the prostaglandins, not the ones that we associate with repro, but the other prostaglandins will be involved in swelling. Frequent milk out and oxytocin. So we're trying to get as much milk out of the udder as we can. So getting another dose of oxytocin in there, squeezing that secretory tissue again, bringing that milk out. With that milk, we're hopefully also going to flush out bacteria. That's the thought behind this. The more frequently we milk, the less bacteria load is on that cow. So cleaning out the bacteria, especially with the coliform, where they're growing in the milk, on the ducts. If we flush everything out, we should flush out the bacteria as well. So what does that mean if we're thinking about it? If we're starting with one bacteria in a solution, and assuming ideal conditions, i.e. they double every 15 minutes, how many bacteria do we have at 2 hours, 4 hours, 8 hours, 12 hours? So if we do the math on that, one bacteria in 4 hours will get up to over 4,000 colony-forming units in 4 hours. We keep doubling every 15 minutes. By the time we get to 8, we've got 8 million colony-forming units in that cow. If we're on a 12-hour milk out schedule, what is that? So million, billion, trillion, 16 trillion.
I think that's billion.
Billion. 2 commas is million. 3 commas, billion. So if we're only doing our regular milk outs, the load on that cow is going to be pretty high. If all those bacteria are producing endotoxins, 4,000 is a whole lot less of a load than it is with our 16 billion. So frequent milk outs, oxytocin, there are some arguments as to whether that is useful or not, but this is the theory behind it. If I can keep flushing those bacteria, the body has less to fight, there's less of a load. The cow can maybe manage and clear the smaller amounts of bacteria faster. If we think about the gram-positive bacteria, gram-positive are going to lack that extra outer layer, as we saw in our picture. So they're going to lack that additional outer layer. So they're going to be responsive to basic antibiotic treatment. So penicillin, this is where penicillin got its foothold, is treating our gram positives, the staph infections, the strep infections that we associated with war wounds. So our World War II is the rise of penicillin taking over and treating the infections associated with the battlefield. So penicillin, for most staph and strep, is still pretty lethal. There are instances of antibiotic resistant, and there's arguments as to whether or not we as dairy producers are responsible for those. I think if you get into the literature, we have a very small role to play in that. We've certainly taken all the antibiotics out of the feeds and things that we used to do just as preventative stuff. I think most of the issues are associated with hospitals. That's my opinion. So the gram positives we're going to run into, we've got 2 of them up here, strep ag and staph aureus. These 2 also fall into that contagious category. So strep ag, contagious, easily treated by antibiotics, very susceptible. Staph is, in and of itself, is very susceptible to antibiotic treatment. The problem is how it behaves in the udder, and we'll get to that next time. Any questions on any of this?
So is gram positive to
Broadly, yes. But not perfectly. We'll see when we get to those handouts there that they are not, there's some overlap. You got strep ag is contagious, strep species are environmental.
You want to look at Pepper's letter? Yeah. Yeah, that's what I was thinking. I'll let you know when we get out. If you wanted to meet later after 11. Yeah. Okay.